Hi, everyone. Thank you for joining us this evening. My name is Ginger Birnbaum, and I'm calling in from Tennessee. I have two children, one of which is living with cystic fibrosis. And so I can honestly say that any time that our CF community gets together is always such a pleasure. Thank you for joining us to talk about school reopening and the decisions that so many households with cystic fibrosis are making around in-person and distance learning. Everyone's circumstances are unique. And so tonight, it's all about getting more information about the risks and benefits and key things to consider while you're making these very big decisions. I can tell you that this has been hard for my own family. Our little boy with CF and my little girl have very different situations. We know that we have to keep that in mind. And so there's a lot to take into consideration, both in the long and the short term. We're pleased to have three speakers joining us for our panel discussion tonight. Dr. Clement Wren, Professor of Clinical Pediatrics and CF Center Director at Riley Hospital for Children and Indiana University School of Medicine. Sarah Strong, a school liaison specialist with Cincinnati Children's Hospital, and Sue Sullivan, Senior Director and Head of Community Partnerships at the Cystic Fibrosis Foundation. And we're saving plenty of time after that panel discussion to answer your questions live. Thank you so much for sending all of your questions in advance. We've gotten many questions, and we've tried to work many of them into the panel discussion, so you can look forward to that. But before we start off that discussion, I'm really excited to welcome Dr. Mike Boyle, who is the President and CEO of the Cystic Fibrosis Foundation, to the virtual stage. Dr. Boyle is going to provide us with an overall update on COVID-19 and the cystic fibrosis community. So, welcome, Dr. Boyle.
Ginger, thank you. Thank you for hosting tonight, and good evening, everyone. It's great to be with you tonight for obviously a very important discussion, something that's all on our minds right now. You know, over the last days and weeks, the CF Foundation has heard from so many parents who are wondering about whether it's safe to send their child with CF or their siblings back to the classroom. We also know there's many adults with CF who are facing the same question with, should I send my children back to school? You know, I had this exact conversation with several of my own patients, and guess what? The answer isn't as easy as I think we'd all like it to be. What you're going to hear tonight is exactly what I talked about with my own patients. That is that there's really no single correct approach that applies to everyone with CF and their families. Like this, I recently had this conversation about school with two people about an hour apart. One was a CF adult trying to decide whether to send his son back to school, and the other was a couple trying to decide whether to send their young son back to school. In one situation, after talking about it, we decided it was absolutely clear that the right approach was distance learning. And in the other, it was, after talking about it, it was felt appropriate, given the details of the situation, to start school and to monitor closely. So my hope tonight is really that you'll come away with two things. The first is knowledge of the factors to consider as you reflect and discuss with your care team what's the right approach for you and for your family. The second is to come away realizing that as you go through this, you're not alone as you make this decision. The CF Foundation, your care teams, and others in the CF community are here to support you as you make your decision, and also to help make your decision once you've made it to implement it successfully. So tonight's event is to make sure that you have the best possible information about the potential risks and the benefits associated with the different school approaches. And hopefully you'll feel empowered to make informed decisions and take the practical steps to protect your health and the health of your family and your loved ones. We also want to make sure that these decisions are based on the most accurate, up-to-date information, scientific information on how COVID-19 is impacting people with CF and children more generally. So while distance learning remains the lowest risk option, obviously from a medical perspective, we also know that it might not be practical for some people for any number of reasons. There are many factors to consider. At the end of the day, the right decision is the one that, after assessing all the factors, best fits you and your family's situation. What we're going to do tonight is I'm going to start off with a brief COVID medical update. And then we're going to turn the program back to Ginger and our panel of experts to talk about really some practical approaches to returning to school and making that whole decision. So let's start talking about the experience of COVID-19 so far in CF. We've been monitoring this very closely through our CF Foundation patient registry. As of actually yesterday, when the data was updated, there's been over 2,000 people with CF in the U.S. who have been tested for COVID-19, so a large amount. As of yesterday, we are aware of 122 cases of COVID-19 and CF in the U.S. A little bit of data about that. So 27% of those required hospitalizations. Well, sort of the flip side, the positive side, is that 73% of people, despite having CF and COVID-19, have been able to stay home and recover. As I mentioned in an update probably about a month ago, there's been still only 2 deaths. One, a person with advanced lung disease, advanced CF lung disease, and the other was somebody who was post-lung transplant. And these are very similar trends to what we've been seeing worldwide in terms of CF and COVID. So overall, we've been pretty encouraged that people with CF are faring better than we initially feared, and that many patients who've had COVID have been able to manage their treatment at home. Yet our understanding of COVID-19 continues to evolve, and we strongly urge people with CF to continue to take special care to avoid exposure. As a way to get started for tonight, let's spend a little more time talking specifically about COVID-19 in children. So this is not children with CF. This is just all children as we think about this. So, I think one of the things to right up front is that I'm aware that there's many sort of misperceptions out there that children don't get sick from COVID-19, or maybe that they don't spread COVID-19. So that is not true. However, it is true that children who get COVID-19 overall do much better than adults. And there's evidence that young children, particularly those under the age of 10, may be less infectious when they do get COVID-19. But there's still so much to learn. So we're going to look at the data that we know and talk about what we don't know, and I think that's going to help sort of inform as we move forward. So I actually pulled up the CDC website to make sure we had the most up-to-date data, and as of 12:30 this afternoon, CDC data says about 7% of all the reported COVID cases in the United States have been children 18 or younger. So that's actually pretty low. That's, it's about 22% of the population is 18 or younger, so about only 7% of the reported COVID cases. Other studies have shown that for the people under the age of 18 that do get COVID, about 90% of those patients are relatively asymptomatic. Some other good news is that the hospitalization rates for children have also been much lower than for adults. Only about 1% of all COVID hospitalizations have been in kids. And that only less than actually 0.1% of the COVID deaths, according to the CDC data today, have occurred in those age 18 years of age or younger. However, we know that in some instances, children can develop more severe symptoms. And there's a very rare but a serious complication called multi-system inflammatory syndrome in children. This has been observed in 342 children in the U.S. to date. A way to think about it is there's about a 1 in 700 chance, if you do get COVID and you're younger, that you could get this inflammatory syndrome. How about the transmissibility part, since that's something we think about as we go through this? There was actually a very interesting recent study from South Korea that addressed this very question about how transmissible is COVID in children. The data suggests that if kids do get COVID, children under 10 transmit the virus at about half the rate of adults, so they're less infective. But what they found in the South Korean study is that for kids 10 and older, it appears that they pass the virus along at about the same frequency as adults. So obviously there's different studies, but that's the largest one to date to maybe give us some guidance. One thing we have to remember as we talk about CF, though, is that for children, just like adults, the presence of an underlying condition raises the risk of serious complications from COVID-19. So if you have the presence of significant CF lung disease, that would certainly make the risk of these complications increase. So while the current data give us many reasons to be hopeful about the prognosis for children in general who contract COVID-19, kids with underlying conditions like CF, I think we want to continue to be extra careful, right, to avoid infection. One other thing before we sort of get into the panel and some of the practical parts is just sort of thinking about this idea of distancing versus risk mitigation. I think one of the things we think about distancing is really this staying so far away or so remote that you can't get COVID. That's sort of the gold standard. but there are so many other strategies to take besides just that. I think one of the things, just to be a couple of these things in terms of risk mitigation, is that public health officials have been increasingly highlighting that many people who end up spreading COVID-19 may have never had any symptoms. They may not know that they're infected, so it makes it important to stay vigilant as we think about this. We already know in the CF community the importance of the basics, right? The infection prevention measures recommended by the CDC, physical distancing, masks, frequent hand washing. I know we're going to talk a lot more about masks as we get later on in the evening, but I think there's just a growing body of evidence about the importance of masks, right? It's clear. And remember, with those face coverings we talk about, we wear face coverings to protect one another. I've heard it said that I wear my mask to protect you, you wear your mask to protect me. The CDC basically recommends that people wear cloth face coverings in public settings when they're around people who don't live in their household, especially when other social distancing measures are difficult to maintain. So as we start to talk about this whole infection, prevention, distancing, risk mitigation in the context of school, just remembering that distancing and staying remote is the gold standard, but there are other important ways, including mask and hand hygiene, that we can minimize risk even when you can't distance. So we're going to start moving to the panel because I know a lot of this is the facts and we need to think about how we're going to put this all together. But before we do that, I just wanted to acknowledge one thing, and it's something that I think we've all felt, and particularly for parents in the CF community, this is a natural time for us all to have anxiety, some confusion. There's been so many different opinions about what's the best approach to dealing with the challenges of the COVID pandemic. Here at the CF Foundation, we are here to support you, to help you select the right approach for you and your family to maneuver through this pandemic. We're going to do this by continuing to provide the best available scientific evidence, access to clinical experts to help frame the discussion that you're going to have with your own care team, and also to support you to assure that once you do make the decision that's the right thing for your family, that you'll be able to implement it successfully. I would just say hang in there. We're in this together, and we're going to make it through this together. So with that, I'm going to turn the program back to Ginger and to our expert panelists, dive in further on really the practical aspects of this very important topic. Thanks, Ginger.
Thank you. Thanks so much, Dr. Boyle. Now I'd like to welcome Dr. Clement Wren, Sarah Strong, and Sue Sullivan to join us for our panel discussion. Here they are. So I do want to note again that we've gotten over 400 questions, and we've worked really hard to incorporate as many of those as we can into these discussions that we're about to have. But first of all, let's talk about the top question on everyone's mind. Is it safe to send someone back to school if they or someone else in the house has CF? Dr. Wren, let's start with you.
Well, thank you. And I want to thank everybody who's dialed into this town hall. We'll do our best to provide you with more information. We may not be able to provide you with all the answers, but at least more information. So, safety, it's kind of a relative thing, right? As Dr. Boyle has pointed out, the safest way to avoid acquiring COVID-19 through the school is not to be physically in school. But so we're really not talking about it's not a yes or no answer. It's more, what are we balancing? What risks are we balancing? And what are the potential downsides of not attending school? And as you've mentioned, Ginger, that there are some people for whom keeping their child out of school is not an option. So with that sort of framework in mind, then the question is, what are some of the considerations that would go into making that kind of decision, and some of the things that people should be thinking about? I think one of the number one things is you really have to look at the local COVID-19 activity. Some organizations have set a threshold of 5% positive rate as sort of the threshold at which you want to be at to minimize transmission. We don't know. It's interesting though. So maybe 5%. We don't know like what happens if you're at 10%, 12%. Probably something like 25% is a little bit worrisome. But that's very, very local. It can vary even by county. Here in Indiana, we have counties where it's only 2%, but then we also have places where it is around 7 or 10%. I think the other consideration is the person's underlying degree of lung problems. And as Dr. Boyle pointed out, the one death in the registry, well, the two deaths, one is post-transplant, but the other one was somebody with, quote, advanced lung disease, and in other words, somebody whose lung function was very low. So that's another consideration. And that's, again, something where talking with your care team and your child's CF caregiver can really provide that perspective. So again, it's kind of looking again at kind of internal things. Knowing what your child is capable of doing, how well can they really wear a mask all day in school, and kind of the flip side too, how what's going to be the impact if they are missing the social interactions and other activities, as well as what's the right learning environment. Some children really can learn in a remote environment better than others. So besides those things, then, I think the other key thing is really looking at what the school is doing to mitigate risk, using exactly the term that Dr. Boyle just used, right? And for that, I think we want to take a step back then and also just think, how is COVID-19 transmitted? And there's basically two primary mechanisms, what we call droplets, and the other is contact. And here in the CF world, we're really used to that because those are the same ways that Pseudomonas is transmitted. Now, recently there's been some concern that you could actually have what's called airborne transmission, which is that droplets that are so small they never fall to the ground. But right now, I think most of the evidence suggests that the primary mechanisms are droplet and contact. Right, and droplets are large enough that they do fall to the ground, usually within 3 to 6 feet, definitely 6 feet. So distancing, our schools incorporating distancing in their classrooms and other settings. Contact, as I mentioned, is exactly that. So obviously, the most direct contact is touching someone who has COVID-19, but sort of indirect contact, like touching a doorknob that has been touched by somebody who's infected, that's another route of transmission. So I think the question then is to look at each in the schools, how are they handling that? How are they handling the parent handle transportation? So if they're using a bus, how are they going to do that? If you're able to drop your child off at school or they're able to walk, obviously that helps that. Again, talking about the classroom, how far apart are the desks? How many kids are going to be in the rooms? Will children be required to wear masks during then? Most schools, I think, again, they're getting rid of lockers because, again, that's another contact potential. Activities, are they going to stop things like music and other things which can generate what we call aerosols, which are again can stay in the air much longer? What's the plan for meals? Are they going to be staggered, or again, will children have assigned seating that's spaced out enough? And how they're handling recess. Basically looking to see, again, how distancing is going to be enforced, as well as minimizing contact, the availability of hand sanitizer. I think those are some of the things that you want to look at for risk mitigation. I think the final thing that I'll kind of turn it over to our other panelists, is that, we've talked about that there are definitely benefits to school. But the question also will be, what is actually the environment and experience that we're going to have in school, right? I mean, it's not going to be like kids sitting around in a circle or something like that, right? Or they're not going to have recess the way kids normally have recess. So again, trying to imagine or understand what that experience is going to be. All of those are factors that ultimately come into balancing those two things about sort of what that relative risk is and what the benefits are. But those are some of the things to consider. And I think I will turn it over to Sue now.
So let the audience. I hope that you guys can hear me. I wanted to let you know also my former role within the CF community was really as an adult CF nurse coordinator. So I'm hoping to bring some perspective in that I can share. I think a few words have immediately stood out to me as we're talking about what does this word safe really mean? And that might be defined differently by different families. This truly is a household decision, and we understand that it's going to impact the entire household. The couple of words that stick out immediately to me is Dr. Wren, you're speaking a lot about the power that information can really provide to a family or a person with CF making this decision. Being informed right now is extremely important. I think also being very flexible is very important. That flexibility is going to come into play whether you're having to make this decision and knowing that the decision that you end up landing on can change. And you might need to sit around your table and really think that through very carefully and be okay with having a flexible mindset right now, because as new issues emerge or new trends emerge in your community, you may need to step back and have a contingency plan, or you might need 2 or 3 plan B, C, and D. As we move into cold and flu season, things might look very different. So we do definitely believe that all families should always have a virtual option. The other, word really that stuck out to me so far, I know Dr. Boyle said this, is empowerment. We really want to give you skills to allow you to feel confident to make a decision, but then the flexibility to change that decision if needed. I think you touched so nicely, Dr. Wren, on a lot of the medical considerations and then a lot of the non-medical considerations with how I'm thinking people define safety. What really does safe mean? It's a component of the medical part, but it's certainly the emotional needs of a person, and we clearly understand that those are really important. In addition to financial concerns, many American citizens outside of the CF community and within the CF community are struggling financially, and it might just not be feasible to even consider a distance option, and that's okay, and we can help walk you through those decision trees. The thing as a nurse that I want to remind each person out there in the community, you've gone through some of these hard decision trees before. While your care centers have not necessarily had to decide or help you figure out if going back to school is a decision, they certainly have helped you come through a decision tree to decide whether or not to admit yourself to the hospital or your child to the hospital, or to start home IVs, or to talk about a big subject like a feeding tube or transplant. Physicians in particular base every medical decision that they're trying to partner with you through a risk-benefit analysis. So this is a comfortable framework for all of your care center staff. So be assured that while it's really scary and a new and emerging topic for all of us, you can feel assured that we will provide you the tools to help you make the best decision. The bottom line is that there's really no right decision. It's going to come down to weighing the risks and benefits of your particular decision, and that's okay to feel flexible. Sarah, I in particular love that you're on our panel as a school liaison, and am curious as to hear your thoughts on this subject too.
No, thank you, Sue, so much. And Dr. Wren and Sue, thank you so much for your comments. You all made such wonderful points, and I feel like I'm going to be reiterating some of them. I think that flexibility is key, and one of the main things to remember is that, CF is different for every single child and every single family, and it's really important that we take that into consideration when you look at options, and really try to figure out with your care team what is the best possible situation for you specifically. And there's a lot of considerations, as Dr. Wren went into, the mental health of your child, of yourself, of the rest of your family, the learning style of your child, behavioral expectations,
There's so much that goes into it, so it's important that we acknowledge that, and also to acknowledge that, school's not going to be the same this year. It's going to look incredibly different for everyone, and this is a change, just to appreciate and know that it's a difficult situation and a difficult decision to make as you move forward, and it's going to impact those social elements, extremely. And I also wanted just to really quickly go over what some of those options are that some schools are giving you. For one, we thought it was really important to let you guys know that different terms are being used kind of the same way. So distance, virtual, online. So as we talk about that, when I say virtual, I am talking about online or distance learning. So the first one is in person. That's kind of self-explanatory. That's when your child would go back to school full time. Then some schools are offering the option of that virtual online option, which would also be, most schools are considering full time for a determinate amount of time. And that would be through a specific program that the school has. A lot of people are using Google Scholar as one, or multiple sites to try to build into it. So it really depends on your district what they're using. The third model that we're most likely seeing is something called a hybrid model, which is where some students are able to go in for a few days during the week, but then they also are doing distance learning or that virtual learning as well, to allow them the opportunity to be back with their peers and experience that in person, but allowing school the time to be able to disinfect and clean the rooms and different things like that. And it also allows for smaller class sizes most often. So those are the three main ones that we kind of talk about. I was also asked, I think there's been some confusion, which is completely understandable, between virtual learning and homeschooling. So when we talk about homeschooling is different. Homeschooling is when you would withdraw your child from their public school district and you yourself would create the curriculum to be able to instruct them. This would give you more of an option in regards to how or what your child was learning. Every single state is different in regards to their requirements for homeschooling. For example, in the state of Ohio, children are still required to take assessments and be counted for that census. However, in the state of Kentucky, there's not really a checkpoint system. So I really encourage you, if you are interested in homeschooling, to look at your state's Department of Education and reach out to them to determine what those are, so that you have a clear understanding and expectations before making that choice, just so that you have all of the facts before making that decision. And I think that's what's really hard, is that everyone's approach is going to be different this school year. And it's difficult to even talk about it in social forums because every state is different, every district is different. Your neighbor next door who could go to a different school district or a private school could be doing something different than what you're doing. So that adds to how many options, that are out there and how to talk about this. I can just say, that I just so appreciate how there's so many different personal situations that are out there, and really encourage everyone to rely on their care team, just to kind of talk that through and to be able to determine what the best route is for you to move forward. And, as you make this decision, please know that schools are considering infection control procedures, but they are teachers and that's not our expertise. And so a little bit of grace. Even if you have suggestions, you guys are experts yourself. And so going in and talking to a teacher about, making some of those recommendations, I honestly can tell you that they would be so thankful and so grateful for your input, just to be able to talk to them and everything like that. But since that does leave us with a little bit of a loss of control, what I really do encourage you is to build up your own child's, self-advocacy. Talk to them about their personal hygiene, about hand washing, about using wipes, and the nice thing about this is at times, sometimes kids can feel different. Why are you getting a wipe before art class? Why are you getting a wipe before music? But really now, everyone should be doing this. These are just the safest things that you can possibly be doing. Putting wipes in your lunchbox, being able to wipe off your own area before you go and sit down, bringing your own utensils. Different things like that are just ways that you can really help your child to know that they're doing all that they can do for themselves. And also encourage them to speak up, and have that conversation of how and what to say. So if you see someone who's not doing what they're supposed to, or you see an adult doing something, come and tell mom and dad, come and let's have a conversation. Or how do you say something of, can you please use a wipe for that? Or, if they're worried, say someone coughed or something and they didn't have a full coverage when they were doing this, how can we help to educate that? And just be able to say, hey, can you just maybe pull that arm up a little bit more, because I could see when you were coughing, that it wasn't fully covered. And that's okay to say that, but sometimes we all need to be encouraged to be able to say that to someone else. And it's always nice to role play that. And it's also difficult because you don't know what's happening in other households or different things like that. And Ginger, I believe we have a question coming up that's about households and schools and things like that. So I'm going to let you kind of take the next step.
Thanks so much. Gosh, this is such valuable information. And I said it at the beginning, but thank you so much to all of you. This is so wonderful to be sharing this with the community and others as well. So yeah, for our next question, Dr. Wren, can you speak more about the risk of sending someone in the household back to school, even if the individual with CF is staying home?
Yeah, so, that's why, all these decisions for every child impacts the entire household. I think once again, pretty much this, well, a couple things, right? I mean, for sure, some of the same considerations, because you want all your children, whether they have CF or not, to have minimal risk of acquiring COVID-19. So once again, thinking about the prevalence, what the rate of COVID-19 is in your region. Is the school doing all of these risk mitigation strategies? And once again, sort of the balance of things. And again, it depends on whether it's an older or younger sibling, right? So, a 5-year-old is probably not going to be wearing his or her mask all the time. They probably wouldn't be able to, they're not going to be pulling out wipes or walking around with a bottle of Purell. 12-year-old is more likely to do those things, right? So I think it's really the same kinds of considerations. But I guess the point is that when you're making these thoughts overall, right, we have to take into account every family member. Other things, I think, certainly, there are some CDC guidelines related to like showering after coming back home, changing clothes, keeping those clothes separate. I think COVID-19 or the coronavirus has a much shorter survival time on cloth and things like that versus like solid surfaces. So those would be some things that people could do too. But I and again, you just sort of have to balance everything. I really think it's hard to imagine that you're going to make everybody quarantined in their own room in their own house. That's where I'm saying it's all that balance.
So much for that information. Yes. Okay, Sarah, what are IEPs and 504 plans? When would I request one, and how could they even help?
Wonderful question, Ginger. Thank you. So for the sake of time, I'm going to give a high overview over what these plans are. And so the caveat I will give is if you do have further questions, please reach out to your care team. And also, please look to Compass as a resource. They can definitely help you navigate to community resources that will be able to help you further explore these plans and which one would be most appropriate for your child. So I'm going to give that caveat at first because they can kind of get confusing sometimes. So with a 504 plan and an IEP, these are both federal documents. A 504 plan is supported under the Rehabilitation Act. It's a civil rights law. It provides accommodations. I like to say a 504 plan kind of levels the playing field. That's a generic way of saying it. It focuses on how the student is learning, And states do not receive any additional funding that are associated with these plans. And it does state, so the person has to qualify for this, just as a qualify for an IEP. So if you are interested in either a 504 plan or an IEP, my recommendation would be to request an evaluation. It's a school-based decision, and you'd be able to go through with them through the evaluation to determine if your child is eligible. Now, for the 504 plan, this evaluation typically contains a specific school form that they would like filled out due to our patients and our children having CF, medical documentation with maybe some recommendations from the medical team in regards to, for example, infection control procedures that would be helpful to have on their plan. And this process would be typically done with a counselor or a school psychologist. And so, excuse me. So really with that 504 plan, I really want to focus on that it is on how the student is learning. With an individualized education program, or plan as it's more commonly called, that focuses on what a student is learning. This evaluation is a little bit more time consuming. It can take up to 3 months due to federal guidelines. And what it does is the child needs to be found eligible under 14 different categorical designations, okay? And so what this does is it breaks down and it determines if there are specific areas that your child needs assistance in with learning. The schools do receive additional funding due to this, because with this individualized education program, it states that your child requires specialized services. Okay, so they receive specially designed instruction to meet their needs because there's that academic component. And this is where both of these plans are really helpful to students, and they're supported in different ways. Parents, like I said, must consent to both before an evaluation, and it's really important that you guys are involved in that process. I think it's super helpful. With the IEP, what I will say is that really work with your school district on this, because it's different per state. So for example, in the state of Ohio, a child who has cystic fibrosis and an IEP, we will place their accommodations for cystic fibrosis onto that same plan. So it'll all be contained in one. In the state of Kentucky, they like to do 2 separate plans. They like to have the individualized education program or plan for just education, and then that child will also have a 504 plan for their accommodations. So this can be a little bit difficult to navigate, which is once again where I would really recommend that you guys reach out to Compass for them to connect you to community involvement to help you kind of go through that plan, or reach out to your clinical care teams as well to be able to try to help to determine the process. I think above all else, the most important thing for either of these plans is communication, especially when it comes to cystic fibrosis. So if the child is going to be hospitalized, what is the impact on that? And what does your child specifically need, right? These are individualized plans. Even though 504 doesn't have it in the name, it is. This is to meet your child's needs. And they both are flexible documents that are designed to grow with the child. So for example, a child who has a 504 plan in kindergarten is going to look very different than a 504 plan in high school. Why? The academic demands increase, all right? And we really need to consider what that extended time looks like. What about prioritization and organization of assignments when absent? What about doing more project-based learning rather than all of the papers that they have, so that they're getting quality over like just content? You know, like we really want that quality right there. And acknowledging that in the middle of the year, and this is what I tell parents often is that you can have a 504 plan in place, and then unfortunately in the middle of the year, something, you know, maybe we'll knock on wood and say no, but this patient has the flu, okay, and they're out for a significant time, but they haven't been absent for maybe 2 or 3 years. They've had great attendance. Well, then as a parent, you have the right to call a meeting and to be able to change that and to add accommodations. So that's what I would say, is just making sure that those accommodations are flexible and they change per age. Ginger?
Thanks, Sarah. I love hearing you talk about the 504 plan. Our family has has been a fan of that. So such a good point to be an advocate. Dr. Wren, what kind of accommodations should I be asking for, either for my student or for myself, partner, spouse, as a school employee?
Okay, well, let's take those two because they're a little bit different. I mean, I think accommodations, which as opposed to sort of the considerations we talked about, really are things that I think there's at least three general things that we want to think about that might apply to CF. Um, the first is cough, right? Because lots of people with CF have a bit of cough every day, all the time. And so making sure that the school and that's something that we write letters about all the time. So I'm sure the care teams can write a letter saying that just a cough alone shouldn't be a reason, not to have the child in school and things. However, I do want that people also consider or recognize that if you have an increased cough, even if it's a pulmonary exacerbation, there's no way that people can say it's not due to COVID-19. And you need to check with your specific school district policy. But most schools are going to say that if you have a new onset cough or an increased cough, that those children will have to quarantine. So it's just something to be aware of and consider. So cough is one thing. The other is enzymes. Most schools don't let children self-administer enzymes. So that means you have to go to the nurse's office. So just making sure, it's not really so much an accommodation, but just making sure, what are they doing in the nurse's office? What other things are taking place in the nursing office? Children are getting inhaled medication therapies, because that happens a lot too for asthma and things like that. What are they doing in terms of infection control? And then I guess the third, which is probably less likely, is again, if your own child, if your child with CF needs nebulized medications, because that's gonna, again, there's more infection control things related to that. So I think those are kind of the sort of the key things beyond just making sure those risk mitigation and the other things that we always write about in terms of needing to go to the bathroom more frequently or having more flexibility with that, and understanding how they're going to handle bathroom privileges, restroom privileges during this COVID-19. In terms of accommodations for people who are school employees, again, I think it's balancing risk, and I think that if, for example, the person is a person with CF with advanced lung disease, I think they need to be in a much safer environment, and that could also apply to a spouse of a person with advanced lung disease. Because despite all of this risk mitigation, there's going to be some risk involved. But in other cases, again, getting back to those key principles, just minimizing droplet transmission, minimizing contact, having hand washing all the time, hand sanitizing, and also making sure that you're not necessarily in an environment where it's going to be much harder to socially distance, depending on the class size, student age, and things like that. So I think those are just some of the concepts and principles to discuss. And I think, of course, I'm a pediatric cystic fibrosis doctor, so when it comes to adult things, I have to ask our colleague Sue to provide some more expert knowledge.
Yeah, I think you raised a great point that we're really asking people and writing the prescription. I'm not a physician, so I can't write a prescription, but I'm writing a virtual prescription to be an advocate. This definitely is not the year to be bashful. Everything that you just said, and we're walking you through the appropriate accommodations that you should expect. And you all know how to be advocates. Advocacy doesn't mean that you need to interpret complicated school board language or infection control policies. It really just means having your voice heard, telling your individual story or your child's story, and then having a very clear way to communicate that, making a list and staying informed, but really just making sure that you have these conversations directly with your school and directly with your employer. Right now is such an important time for the CF Foundation. Many of my colleagues and many of you in the CF community are strong advocates. Currently, Congress is negotiating right now expanded paid leave for both people, with chronic health conditions and also other household members who work. Now is the time if you want to get involved. I know that they'll be dropping in the chat that information on how to be a bigger advocate, but we're also just stressing the importance to use your voice. Every voice matters. And I know, Ginger, you are super into the call to advocacy. So I know that you could also highlight the importance there. So, Sarah, anything else from your end?
I would just definitely second. It's definitely a time to be a strong advocate, and I think as a community, as we discuss things, once again, just to remember that every school district is different, budgets are different, resources are different. As we look at these different accommodations and plans, I think it's wonderful to be able to communicate with each other and look at that, and just really once again communicate with your school. I think it's really important for you to know what your school plan is, so then that you guys can have just really informed discussions with them about what your child needs and how to implement those accommodations within that setting. And one thing that I think is really helpful is teachers, sometimes it can be frustrating, but it's difficult to respond in a timely manner sometimes because people are busy. So as we talk about communication, at the start of the school year, asking who would be the best point person. If I can't get a hold of you, who should I contact to be able to talk about those accommodations, especially if mistakes happen, which they probably will because we're still learning this. And so it'll be a quick way for us to be able to kind of mediate that and make sure that it gets back on track for the patient. But I definitely would second all of the wonderful accommodations that Dr. Wren and Sue said. Thanks, Ginger.
Thanks, Sarah. And yes, on the advocacy note, use your voices. Feel empowered to communicate and educate your communities. So important. Dr. Wren, what about college?
Sorry, tried to unmute. Well, I think it's the same considerations apply pretty much. Hopefully college age students are able to wear masks and do things like that. But again, it's the same things. I think one consideration obviously is dormitory rooms, and I think that again. People have to be, well, it depends on the university or the college and what they offer. So actually my daughter is going to be a freshman in college 2 weeks from now. And they have converted all the dorm rooms to single rooms, and because so clearly being like I think that's probably one of the major considerations would be the dormitories. And again, the meal halls, dining facilities. But other than that, it's pretty much the same considerations that we've discussed. And I guess we can see, right, Sue also probably has some things that she could share about that.
Yeah, the only other thing that I would add is you do need to financially protect yourself. It's really important to have a letter written and on file at their office of disability or whatever they call it at your particular college and university, because you really need permission to go virtual at any time. We don't know where the pandemic is headed. And if you already have a letter on file, you might need to talk to your care center staff member who does that, whether it's the social worker or nurse coordinator, to see if there are additional accommodations because of the pandemic that needed to be added. So that way, if you have to drop out of a class or move to a virtual option, you're not financially penalized. I know that we have a lot of questions. Ginger, I'm going to turn it over to you. I think maybe we're headed towards the live Q&A.
We are. I can't believe it's time. Listening to you talking about college, I have an 8 and an 11-year-old, so that my head is spinning just thinking about that. But it's an exciting time for so many. Thank you so much to each of you, Dr. Wren, Sue, and Sarah. So we'll take the rest of our time now to answer questions from our audience. And like I said earlier, we did get so many questions from people in advance. I do want to note and make a reminder that we can't address individual or personal situations. So please try to phrase your question in a way that would be more broadly applicable. And even if we can't get to every question during tonight's event, and I'm guessing that that may be the case since there are so many good ones, we will be making every effort to address your questions in our online FAQ around COVID-19, and that is posted on cff.org if you haven't checked that out yet. So let's get to that first question. This is one that was sent in by so many people, so many registrants on the front end. So we're going to start with that one. It's quite a popular one. So this is about masks. We're getting a number of questions about masks. And Dr. Wren, we're hoping that you can speak on this topic, but also elaborate perhaps kind of on some specifics. Is it safe for people with CF to wear masks for a long time? Are masks risky in some way? So if you could speak to it in that way as well.
Sure. Well, so I think the first thing is, let's make sure we're all on the same page in terms of what we mean by masks, because there's really kind of three broad categories of masks, kind of from the most tight mask, I guess I would say, to less so, right? Most people probably heard this term N95, right? So an N95 mask filters out 95% of the particles and is super tight and really can filter out aerosol things. But those are really not practical to wear outside the hospital setting. First of all, you have to be fit tested for them. And fit testing actually is something that has to be done in the hospital because they actually check to see whether or not you get a complete seal. Secondly, I can tell you, having worn those, you cannot wear them for very long periods of time because it really is like breathing through, well, more like a tight filter. And they're very uncomfortable actually because they press right on your face. So N95 really isn't something that we should be discussing in a school or outside setting. So then you basically have surgical masks and cloth masks. And actually the term surgical mask is a bit of a misnomer because even with all those masks you see people wear in the hospital, there are actually subtle differences between them. But overall, they block droplets. And you know, I don't think anybody has specifically looked at the safety in people with CF, but certainly those masks can be worn for hours for medical procedures that people are performing, physicians are performing, and again, there's relatively limited data, but they probably block out particles for at least 4 to 6 hours at least. Nobody's really known beyond then. And again, traditionally, you're not supposed to reuse them, but again, during this crisis, when there's a big crisis on masks that probably everybody remembers hearing about, like in March and April, that people were doing that. And then finally, you know, they're cloth masks. And cloth masks in general, the holes are going to be a bit larger, so they may not block every particle, but actually the irony is they're probably more comfortable because of that. There's definitely evidence that any type of mask, just as Dr. Boyle said, reduces transmission of COVID-19, and it's in both directions, right? It's not really just how it protects you, but also how asymptomatic people who might be COVID-19 positive are unable to transmit as many particles. So again, that's where it's really making sure that how masks are being used in the school environment that is very important. And I guess, for the sake of time, I think that's sort of what I would say about masks, because I know we have a lot of other questions on the list here.
We do. Thanks so much. So for our next question, again, this one we'll start out with you, Dr. Wren, and then maybe Sue and Sarah, if you have thoughts to add as well. So let's discuss extracurricular activities. This is actually a question that's coming from our audience this evening. Are there activities that would be safe for kids to participate in, even or maybe especially if they are doing distance learning for school?
So you mean like sports and things, or
Yeah.
yeah. So well, so again, we just go back to those same principles of droplet and contact, right? So for example, we just sort of take. Obviously, can't give a list of every sport, but thinking about something like singles tennis, well, you're pretty far apart from other people, right? Versus like wrestling, which is going to be really a lot of contact, right? So I think again, you know, it's considering the sport and again all those other factors. We know that sports, are again psychologically, there's a lot of emotional well-being that comes out of participating in sports. So I think all those factors need to be considered. Other activities, again, singing, we know that generates these, what we call airborne aerosols. And you can't really sing with a mask on. So again, it would probably be something that again, it's all about balance, but in general, that would very be something that would be preferable to avoid because of the risks involved. And I'll let Sue and Sarah comment whether they have any other thoughts about this or have encountered other issues like that.
I'm happy to just share that. I think whether you're talking about sports or extracurricular activities or getting together in your community and having kids run around, a lot of it comes down to trust and transparency and understanding, then you have to sort of add and factor in the, whether it's a school-based sports program, and understand and ask new questions of how they would handle if there was an exposure. It sort of ties into a lot of the old principles that we've already been talking about. But if you're, trust and transparency are really, really important, and knowing sort of where other families align in their thinking on the pandemic is probably another consideration that I would suggest as well when making a decision. Sarah, anything from you?
Yeah, I would just really, what I would say as a former coach myself, if you have a child who really loves their sport, but unfortunately you guys talk with your clinical care team and they're like, what, it's just acute contact, as Dr. Wren was saying, and we have worries about this, I would encourage you to reach out to them and see, can they come and socially distance, wear a mask, maybe how about with stats, or, how can they still be a part of that team but not be physically participating in it? Can they, help to go run to get different things for the coach or different things like that, have them feel definitely useful and helpful to the team, so that socially and emotionally they're still connected and they still fulfill that need that they have. And I would say developmentally it can be really for any age, even for those young ones who are in T-ball, if they want to go and just cheer their friends on and you can make signs, I would really strongly suggest you do that.
Thanks for those answers. Before we go any further, I do want to let our audience know that because we've gotten so many incredible questions, we are going to go over a little bit, but I think like any meeting, same principle applies. If you must hop off, don't feel that you have to stay until the bitter end. But if you can hang out with us, we would love to keep you here and answer your questions. So just so you know how we're doing on time. Okay, our next question is for Sarah and Dr. Wren. How should we help our kids with anxiety about returning to school? And let's go ahead and start with Sarah.
Well, I think one important thing to know is I think that mental health aspect is that parents, you guys have anxiety too. Kids have anxiety. How do we support, as siblings have anxiety, how do we support a whole unit with that transition back to school? For one, I would say be talking about your routine. maybe a few weeks before the start of school, starting to get up early, getting back used to doing that treatment early. It's been a while since kids have had to hold to that routine. I would also recommend talking to your kids about fatigue. A full day is a long day to go, and that can increase behaviors. And with kids, sometimes all we see is that behaviors, and really they're just saying, I'm tired, I'm hungry, this is hard, and so encouraging those conversations. I would also, transitions are tough on kids. I tell parents this at the start of the school year, give it 6 weeks. You're going to see some highs and lows. I would say give yourself a little bit more grace. This is a difficult time. Talk to your schools. Maybe some days your child will have to leave early. Maybe some days they're going to have to come in late. Allow them that mental space and time to talk to you about how they're feeling, both physically and emotionally. On those days they can't be there, they can write letters to their friends if they're feeling, that fear of missing out. Can you FaceTime with the teacher or jump on a Blue Jeans call? I would say practice, take time, talk about it, and have realistic expectations for you and your child. It will not be the same as last year. It's going to be very, very different. That's kind of okay, kind of not okay, right? We're all struggling with that. We're kind of in that middle lane. So I would say just give everybody some grace.
Yeah, I think I would echo those things, especially I think the first thing that Sarah said, which is that, the kids sense anxiety from their parents. So I think one thing is providing a very positive outlook, starting to reintroduce those routines. And just as Sarah said, I think recognizing that there may be stressful days and that where kids do need to step back, and gets back to one of the themes we've talked about, that advocating, and it's not even so much advocating. I think just informing and working with your schools so that they anticipate and understand that these things may occur.
Thank you. Okay, let's see. For Dr. Wren, is it safe to join up with another family for play dates or other activities?
Yeah, well, so once again, I think it's the same principles. First of all, you got to think about how much COVID-19 is in your area. Got to and then consider. I think smaller groups outside. Those are all things that have been shown to be associated with lower risk. And again, you have to think about the age of the kids and whether they're able to maintain social distancing and things. So again, it's not a yes or no answer. I think it's, but I certainly I would not advocate that kids don't have any of that contact. Just take into account all of these different factors and employ the sorts of again, this term that we keep using, risk mitigation strategies that are possible.
Thank you. So for Sarah, can you clarify if distance learning is something that we would request through a 504 plan if our school isn't offering it? Do private schools have to offer these accommodations?
So that is a wonderful question, and it's also somewhat difficult to answer. So when we talk about distance learning through a 504 plan, if school is not offering it, one of my questions would be, are they offering distance learning in another format? Is that other format that they're offering it through packets? And if it is through packets, then unfortunately, due to the fact that they are offering that, they legally don't have to offer a virtual platform. And because they are having the packets, that's their way of meeting that need. It would not be something put on a 504 plan because the same thing is being offered to their peers. So they can still access the general education curriculum the same as their peers. For a private school, that gets a little bit more difficult to answer because, for one, it would depend if some private schools do support those federal plans, such as an IEP and a 504 plan that I talked about. That's a little bit different. If a school does not support that, unfortunately, legally they are not held to need to. They are required to offer students, of course, education. And so once again, if they're offering packets or different things like that as their form, then they're meeting that need. So once again, I really encourage you, because these situations are unique, to reach out to Compass to connect you to someone in your community so that you can have those conversations with a little bit more depth to help you navigate it, because it can be difficult to find where those next steps are.
And Sarah, while we have you, yes, but while we have you, and I would just ask this to follow up with what you were saying. When you're talking about packets, you mean the information that is that's like sent home, like worksheets and that sort of thing?
Yeah, so sometimes they can do, so they'll call it that distance learning, but it's done with like actual paper materials that are sent. And that can be done for multiple reasons, because the community might not have access to Wi-Fi, to electronics, to some of those tools that we have. And so as a school, they have to meet all of the needs. And so as teachers are saying, okay, just focus on the packets, don't do both virtual and packets, because it became too confusing for some teachers.
Thank you for clarifying that.
You're welcome.
Also, you started talking about it a little bit earlier, but how can we help kids who are distance learning to stay connected to their teachers and to their peers? Do you have suggestions for that? And then I think for all of our panelists, if you have thoughts on that, please share.
Yeah, I think, it's kind of funny to say old school, but it's really fun to get mail. Like I know our patients love it to be able to get a letter with their name on it or something. I'd encourage, pen pals. It sounds kind of funny, but even if it's through email, and you can send fun photos or, through the mail. And for the class too, you can be able to take pictures and say, this is the project that I made. Sending each other videos, setting up phone calls. If the school has that availability to do that, you can also just also talking to your child about this, because one thing I found is that, like, especially our patients with CF, they're just so creative that, like, sometimes they'll think of something that, like, I wouldn't have even thought of. Like, we have some amazing artists, and like one was like, oh, I can do a mural, and I'm like, yeah, do a mural. Like, I can't do a mural, but if you want to, go for it. So I would say talk to your child about what things that they may want to do. You can do virtual lunch times. So set up a phone and be able to have your child have a couple other kids and let them talk about whatever they want. It's lunchtime. That's what they did then. Or, even playing like Chutes and Ladders across, through the computer. You can do things like that. So just getting creative with how to stay connected. Dr. Wren, Sue, anything to follow up with that?
I'm happy to just, go ahead.
No, go ahead, Sue.
I think it's also important to be okay if there's extra screen time. It's somewhat of a reality at times, and I think sort of as parent, I'm a mom, and that mom guilt can be very real, and but allowing yourself, like you had mentioned many times, Sarah, like have extra grace with yourselves. So if kids connect through video games and that's really the joy that they're finding right now, and normally under normal circumstances, you limit their screen time, maybe it's time to reassess their rules while they can't go outside and play all of the time is one other thought that popped in my head. Anything from you, Dr. Wren?
No, I think you guys have mentioned many of the things that I would suggest. I think there's a lot of ways to connect via video, and maybe we will see a resurgence of letter writing or cards, and so I think just I actually think doing things like that, just little projects, and creating something like that. Is provides kind of a sense of accomplishment, or just tangible activity.
The only other thing that I'll add, because it's relevant, as we think about adult connections or parents, they're struggling to make these complicated decisions. One program that I'm fortunate to help support is CF Peer Connect. And I know that the moderators will drop the link in the chat, but if you're looking to connect with another person that is sort of, you just want to go through this process and be able to talk about it with someone and get that connection, either as a parent or as an adult with CF, there's that option too, just to help kind of stay connected and support each other that way.
Yeah, thank you. Dr. Wren, apparently this next question is very, very popular, and everyone would like to know your thoughts on this. At what point should we pull a child or teacher from school if someone in the school tests positive?
Well, I mean, if somebody is positive, and there you can trace that contact back to your student, I think I think it would be reasonable to take your child out of school at that point. There are, I can tell you also, there will definitely, every school is going to have a policy that that you can check on ahead of time, and most of the schools are doing something like that. And I think that's one of the biggest concerns about reopening schools. Again, that's why we'd say all the stuff we did, that's why we call it risk mitigation, not risk elimination. So, I mean, if there's a child that is positive, I think that would be reasonable to take your child out of school, monitor closely, and then work with your care team to determine whether COVID-19 testing is necessary and things like that.
Thank you.
Ginger, can I jump on real fast?
Absolutely.
So for parents to know, if you are in a situation where your school district said you had to choose to be in person full time or online full time, and you choose to be in person but are worried about that happening, and then saying, okay, then I have to pull my child out, then what? How will they get their instruction? I think it's very reasonable, due to the fact that your child has been diagnosed with CF, to ask school for an exemption for that policy. I think it'd be really reasonable to talk with your care team to get a letter and say, hey, if I have to pull them out, can we switch to virtual? I just wanted to add that. Thanks, Ginger.
Yeah, thank you. Okay, this next question is for Sue. Are there additional precautions you'd recommend for teachers or other adults working in the school environment? How can they advocate for themselves and help others in their classrooms understand the risk?
Ooh, it's not easy, but to me, it doesn't matter necessarily if you're a teacher or someone that has a different profession. I might approach it the same way, understanding that you have protections too. But again, this comes down to, it can vary by state. I have talked to certain teachers with cystic fibrosis, and they, just given the state that they live in, have particular, things that, because of where they are, they're allowed to remotely teach. It does, Sarah, I don't know, feel free to jump in at any point, but you want to understand what your administrators' policies are, and that's why we're sort of really fighting hard to advocate for that expanded family leave, because you do have to protect yourself. I'm assuming the question, is it a person with CF who's a teacher or a parent who's a teacher?
Do you want me to clarify?
Yeah, that may,
okay.
For Sarah, if you help jump in.
Yeah, I would say if it's a teacher and you're a part of a union, I would really recommend working with your union to see what your options would be. And also, to discuss, kind of bring some of that information from your team back to those leaders so that you guys can make informed decisions about your educational practice. That's what I would say.
Yeah, and to clarify, the question was regarding teachers or other adults working in the school environment. So I think, yeah. Thanks, Shaul. Okay, we have, I think, one more question. And this is for Dr. Wren. Is there any concern about cleaning solutions used for sterilizing school environments being dangerous for kids with CF?
I'm going to have to be honest and say that I haven't heard anything about that. Most of these, they're pretty, I mean, mostly, a lot of them are kind of standard cleaning. I mean, you don't have to do anything particularly special for coronavirus. It's the same thing: soap, 70% alcohol, and other disinfectants. So I don't know that they would necessarily be dangerous. Of course, those fumes can be irritating. So again, it's something might be something to anticipate. And again, if children are coughing because they have CF and their lungs are more sensitive, to prepare or work with your care teams to make sure that the schools are aware of that.
Thank you for answering that question. And I think that ends our time together tonight. I think, my biggest takeaway from everything that we've discussed is that every situation is very different and everyone is so unique, and every family is too. So it's important that you talk to your loved one's care team as you're making these decisions about school. They really do know you best, and they know your circumstances, and they want to help you sort through. I think someone mentioned as a decision tree, maybe Sue, and I think that's such an excellent term for what our care teams do for us, so that you can make the best decision. I want to thank Dr. Boyle, Dr. Wren, Sarah Strong, and Sue Sullivan for speaking with us and sharing their time with us. And thanks to our chat moderators, Jackie Schoberg and Stacy Van Gort. And really just thanks to all of you for joining us and for being a part of this community event. It's been so impactful. A recording of tonight's event will be posted on YouTube for those that missed it. And anyone that attended or registered for the event will receive an email tomorrow with a link to that recording. That email will also include more information about Compass and other available resources around this topic. So, thanks again for joining. Be well and stay safe. And we'll see you soon, hopefully.
Bye.
Good night. Bye. Thank you.